Well, hello. Good morning to you, class, and good morning to you, Dr. DeShong. My name is Robert McAlpin, and I'm going to be giving a presentation this morning going over self of a therapist and counseling infertile couples and women. But before I do that, I'd just kind of like to give a little brief introduction of myself. I've been on active duty in the Army now for 18 years. I'm currently serving at Fort Bragg. I'm married. And I have one daughter. She's 11 years old, and I look forward to retirement from the Army in the next couple of years, and Lord willing, I plan to become a licensed professional counselor. So with all that, let's just go ahead and go right into the presentation itself. When I think of self of the therapist, I think of what the needs are there for the client coming in and how we can better accommodate them. Self of the therapist is being able to assist the client in such a way that they're not totally dependent upon us, but we can be able to give them a great deal of knowledge and information that will allow them to be able to make their own decisions, to make their own and to heal at their own pace. And especially in sexual problems are very common, and sexual development itself is a lifelong process, and it's a likelihood that a counselor will work with clients struggling with some aspect of their sexuality is very high. Whether that be they don't have very good communication with their spouse, they may have some type of sexual dysfunction, they may have something that they just don't feel right about themselves sexually. So these are going to be very common occurrences, and we should be prepared for those. The counselors should be competent in helping people with sexual problems. Unfortunately, as of right now, the Council for Accreditation of Counseling and Related Educational Programs only require that sexuality counseling be included as part of the marriage, couples, and family counseling concentration. So for the licensed professional counselor program, this really isn't even required for that certification. As a result, we should always try to look for ways, even when we're licensed or when we're out in practice, we should always look for ways that we might be able to perhaps get extra CEUs going over sexual problems and sexual cases, because this is something that will be going to happen. It's going to happen to us. We're going to be to see these people coming in, and we need to be prepared for that. And we need to be able to, and as far as all that goes, we should be able to want to increase our training in these sexually related problems. We may want to look at exploring the various dimensions of sexuality, or increase self-awareness regarding sexual biases, increasing comfort with addressing sexuality with the clients. And we have to remember that the clients coming in may not think about us as being able to open up to us unless we give them the right impression about us, that they can talk openly and confidently with us, that they feel that bond with their therapist. And increasing knowledge of a healthy sexual development. We should stress to our clients that a healthy sexual life will also lead to well-being of the entire individual. So we should stress that they should try to have a healthy sex life with their spouse. And sexual dysfunction is one of those problems there that we were discussing earlier, and this is also something that's commonplace among among people that we may deal with. The sexual dysfunction can come in many different styles and shapes, and it can come in they're not able to perform adequately, or they're not able to perform to their satisfaction. So for sexual dysfunction, it is important to assess the limitations of one's own expertise in this. Like I say, we may not be able to have all of the right answers in order to help our client, but we should at least be able to get the good information that we need in order to give these people a proper referral to a sexual therapist. And sexual therapists, they specialize in the treatment of sexual dysfunction. However, the client he or she may feel they may not be very comfortable being referred to someone else, since they come to you in order to discuss this very, very emotional problem and a very personal problem. So just please reassure your client that you have the best interests in store for them, and that you want to help them, and that you'll be with them through every step of the way going through this. Some assessment in sexuality counseling. Just as it is important to be aware of personal bias and determine a model of sexuality counseling, assessment is essential to conceptualize a client's sexual concern. So prior to assessing, a counselor should contemplate several questions that will aid in this process. Number one, who is this conversation for? Is it for the husband? Is it for the spouse? Is it for both? What is the purpose of gathering this information? And what will be done with it? What does the client need or want to tell? And what will he or she find out that is useful in this conversation? Is there anything I know thus far that would indicate sexual issues? Am I avoiding asking about sex, or is it really relevant? Will my client feel comfortable talking to me about sex? Or how will I know if they are comfortable in talking with me? And how will I know if I'm being inappropriate or intrusive with my questions? These are some of the things that will be addressed during the assessment with all the coming in with sexual problems. And through the assessment will also lead into treatment planning. And in treatment, so after assessment of sexuality and sexual behavior, the next step involves identifying goals, developing a treatment plan, and implementing interventions. So when setting goals with a client, it is important to first determine a common definition of the problem. The problem itself may be magnified in one of the people in the couple relationship, or the other person may not even think there is a problem. So these are some questions that really need to be answered, so that way the effective treatment can be given. And in a summary of self of the therapist, sexuality counseling is essential because that is something that we will be doing, I'm certain, quite commonplace. And we want to include sexuality-specific questions in the assessment to be able to help them with their treatment. And we want to highlight sexuality as part of the overall wellness. A good sexual relationship equals a good, healthy adult. So now I want to go ahead and go into the topic of my research paper, which was infertility among couples and women, and what we can help to do with them as counselors. And the reason that I chose this is because infertility is a very sad diagnosis to a lot of women and couples out there who want to have children and are incapable of having them. And it occurs in 5% of the population, and it occurs within 5% of couples within the United States. And they come into you for counseling, and they're very hurt, they're very stressed, and they need help. And in all of the classes and all of the subjects that we've discussed here in our human sexuality development class, this is one that really struck out to me, and I hope that you'll find this topic enjoyable. So, over the introduction of this, we'll be going over the definition of infertility, the role stress plays in infertility, females with infertility, couples and social support, and we'll be going over some aspects of clinical medicine, and then finally the conclusion. So infertility, what is the definition? Infertility is the inability to conceive a pregnancy after a year or more of regular sexual relations without contraception, or the inability to carry pregnancies to a live birth. And like I was saying earlier, this affects 5% of the population between couples here in the United States. The role stress plays in infertility. Stress is very real, very real in infertility. And researchers thought it was a woman's psychological problems that caused the infertility to start with. That's what used to be thought of, because women would, this would be something women would dwell on, and it would be just something that went over and over to them, and it would cause psychological problems, stress leading to depression, and then researchers thought that the next step would be it would cause infertility for them. But they now know that this isn't correct, but which high expectations that parenthood will meet life goals. And during my research, some women and couples felt that without being able to be parents, they won't be able to have children. They won't be able to rear children, to bring them up, and half of their goal in life will be missed, being able to share that with someone else. And then preoccupation with a search for the cause. So women and couples, they during this research have been looking for a cause of being able to find out why they can't conceive, why they can't have children. And they went from one therapist to another, one sex therapist to another, one psychiatrist to another, looking for anything that may open up their mind to this. And then stress also will they have low satisfaction with social support. They don't have a very good they don't really talk about these things with other individuals, because it's a very personal issue, and they don't have a very good relationship either with their extended family, and being able to discuss infertility and the stress it plays out. So, and according to my research, the social support that a couple gets from with having infertility is through each other. So if they have a good relationship, if the husband and wife have a good relationship with each other, then they'll be able to be a good mutual support system for one another. And if they don't have a good, if they don't have that good relationship, then depression and stress will certainly be heightened. So females with infertility. Females that have had problems with infertility feel that if they're not able to conceive, if they're not able to have children, it leads to feelings of failure within the woman herself. She feels that the culture is stigmatized to her because motherhood and womanhood are both inseparable, and a lot of times in the society today, if a woman is unable to conceive, or if a woman doesn't have children, if she goes through life not bearing children, then she is looked upon with pity and selfishness through other people in society. Now, for couples with infertility, the spouse is the biggest source of encouragement and conflict in this. As I was saying earlier, when couples discuss their infertility problems with someone else, it's always most of the time with the spouse. So if they have a good relationship, it will be an encouragement, but if they don't, it will be a big source of conflict. And they don't receive adequate support from network members because they don't feel comfortable talking with other people about this. They don't receive adequate support from extended family members, or they don't feel that they receive adequate support from their extended families. And the support almost exclusively comes through the spouse, or the lack thereof comes through the spouse. So we'll go ahead and touch on some aspects of clinical medicine at this time. Some factors that lead to infertility. One is a high expectation that parenthood will meet life goals. A preoccupation with a search for a cause of the infertility. Low perceived personal control. Avoidance and denial of infertility. And that's very common in men and women both, because they feel like there will soon be, if they just keep having regular sex, without contraception, that they will eventually be able to have children. Sometimes that's true, but within 5% of the population, there is another cause, another reason that they can't have. So it's something that is still ongoing, and the research looks very promising on this. And low satisfaction with social support. So if they don't have a good relationship with their spouse, then they will have low satisfaction. Some causes of male infertility that you see here: abnormal sperm production, and this could be caused by testicles being undescended, genetic defects, and health problems. Also, causes of male infertility are sexual problems such as premature ejaculation, or genetic diseases such as cystic fibrosis, overexposure to environmental factors that you see there. Cigarette smoking and alcohol and marijuana are all absolute no-nos if those who are trying to become pregnant. These three factors here are a great risk factor for those wanting to be able to conceive children. And certain medications that you see here, some select antibiotics, some different types of steroids, and blood pressure medication can cause male infertility. Some causes of female infertility. One is ovulation disorders. This is the most common in females. And some hormonal disorders branches off from this. Polycystic ovary syndrome and hyper or hypothyroidism can cause some of these hormonal disorders. Excessive exercise can cause their infertility, or the lack of exercise can cause infertility. Eating disorders such as anorexia or bulimia can cause infertility. Injury or tumors and uterine or cervical abnormalities also cause infertility in females. Both risk factors for men and women for infertility. Increased age is a big one. Women start to develop more infertility as she goes into the mid to her late 30s. Men is generally after the age of 40. And as I was saying earlier, tobacco use, alcohol use, something you don't want to do, something you don't want to consider if you're trying to have children. Being overweight or underweight, and either not enough exercise or too much exercise can increase your risk for infertility. And then some of the treatment modes for infertility that we have today is, you can see these here: gamete intrafallopian transfer, embryo freezing, embryo transfer, and psychological counseling. And there is coping and support for those who are undergoing treatment for infertility and being able to receive help for not being able to have children. It's important that we, especially as counselors, we acknowledge their concerns and feelings in the matter, and that we're always a supportive help to them. And asking questions about treatments and counseling, we should always be open to any questions that they may have, and be open to whatever they may want to try. Decide before starting treatments which procedures, how many are emotionally and financially acceptable, and considering other options. Sometimes we may be able to help steer our clients for adoption, either donor sperm or egg, donor embryo, and gestational carrier. And in conclusion, infertility can be a trying diagnosis for couples and women wanting children. The field of research in infertility is changing continuously, and there may be a cure around the corner for many women in the future. The field of infertility is wide open right now, and research is being conducted continuously, and we hope to be able to have a time where all women and couples who want to have children can have them. I do want to thank you all for being patient and listening to my discussion, and I do hope that you have a great day and a great rest of the semester.